So David Clark is out and Chris Hipkins is in. The new Health Minister is also the Minister of Education and State Services, the Leader of the House, and the Minister responsible for Ministerial Services. I spoke to Chris Hipkins a little earlier and asked if this is a major career boost for him or a complete nightmare.
Oh, look, I'm always up for a challenge. I think there's no doubt that health is a big role, and I've got a big role with education, but I think it's a really important job, clearly in the context of COVID-19. We've got a lot of work ahead of us.
Can you do both jobs justice?
Yeah, I think I can. Obviously, I don't think I could do that forever, but I certainly think for the next 3 months I can give both of those portfolios the attention that they need.
So, when the Prime Minister raised this with you, did you think about turning it down? Did you turn it down?
Oh, look, we had a good, honest conversation about it. Obviously, I'll need some support in the role from associate ministers and from staff, and I'm confident that I'll be able to get all of the support that I need to be able to do the job effectively.
When you say you had a good, honest conversation with her, what did that involve? Were you a reluctant starter? Was it a surprise to you?
No, we had a good, honest conversation about the challenges that are ahead. Obviously, COVID-19 has thrown into sharp relief some of the pressure that our health system is under, and so we had a conversation about that and some of the things that need to happen there. Obviously, there have been some shortcomings in recent months. I think my colleague, Dr. Megan Woods, has already got on top of the issues around the border and around managed isolation, and I'm very confident in the work she's doing there. There's still some work to be done around testing and contact tracing, and I'm looking forward to rolling my sleeves up and getting into that. And then, of course, there are the wider challenges in the health portfolio. We've got the Heather Simpson review, which now sits with the government. We need to work our way through that and make sure that we've got a good, solid government response to that.
When did you have the conversation with the Prime Minister? When did she say she wanted you to take this portfolio?
I think the Prime Minister has said, these conversations have been ongoing over the last week or so. I probably first had the conversation with her about a week ago when she was having conversations with Dr. Clark. I think everybody at that point was approaching things with an open mind, and we were looking at a variety of different options at that time. Dr. Clark was considering his own future and has taken some time to reflect on that.
Which one of these two big portfolios that you've got, health and education, which one's the top priority?
Look, they're both a top priority. I'm absolutely
but you're not going to be able
to give them.
You're not going to be able to give them equal time and equal consideration. So where are your priorities going to lie? Health or education?
Look, there is no question there are some immediate issues in health that I'm going to have to devote some time to. I'm very confident that we've got education into a good space. There are a number of projects now that are ongoing where the work is being done, where the policy work and the implementation work that I needed to do as a minister has been done, and those things are now underway. Of course, I want to keep an eye on those and make sure that we continue to make progress there. So I'm confident that I can keep a good watching overview over what's happening in education whilst also helping to address some of the challenges that we're facing in health.
But health's the top job?
No, look, I wouldn't say that, because education is obviously something that I'm very passionate about as well. So
but something's got to give, though, doesn't it, Minister? Something's got to give. We've got a pandemic. The Prime Minister keeps telling us it's not over. In fact, it's getting worse offshore. It's a big job to deal with that. You're not going to be able to give those portfolios equal weight and attention, are you? So one's got to come first. Which is it?
Yeah, no, look, I wouldn't characterise it like that. I think it is actually possible to do both jobs. Like I said, I don't think it would necessarily be sustainable over many years, but I think in the 3 months in the run-up to an election, I think it's certainly doable.
So you've got, 79 days to the election. What are you going to do in that time in health, or are you just going to stand still? Are you just the space holder?
No, I think, as I said, the first priority is the COVID-19 response. So I think that we've got to look very closely at how that's going. We've got to look at any areas where we think we can sharpen that response up, and that's first order of business. We've then got the Heather Simpson review, which we have to look at carefully and make sure that we've got a good, solid government response to that. Have you read that yet, the Heather Simpson review? As the Minister of the Cabinet, I've certainly read the papers that have come to Cabinet on that.
But you haven't read the review yet?
I haven't yet had a chance to read through the entirety of the review, but I'll certainly do that over the weekend. Then, of course, there's some issues around health spending as well. So there's a big capital investment spend program going on in health, as there is in education. We want to make sure that those big capital programs stay on track and that we're shifting that money out the door. That's actually a really important part of our economic recovery, making sure that those capital investments are delivering the jobs that we want them to. So I'll be monitoring that very closely.
Were you the first choice of the Prime Minister for this job?
Look, that's something you'd need to ask the Prime Minister.
Do you know if you were the first choice or not? Or had she gone to someone else who said, no way, no thanks, Health?
I'm certainly not aware that she's asked anybody else to take the role on. When she asked me if I would consider doing it, we had a good conversation about it. In the end, I said yes, I think I would be willing to take the job on.
Do you want the job permanently after the election if you're still in government?
Look, that's a question for another day. My focus is on what's
Why not?
What's going to happen
Let's get
in the
to it now. Well, let's get to it now. I mean, if you're keen on it and it's something you wanted to take on, are you committed to the point that you would want to be the Health Minister after the election if the opportunity arises?
Oh, look, I'm very happy to continue to serve in whatever role the Prime Minister asks me to if we're forming the government after the next election.
How are you different from David Clark?
Look, David Clark is a very good friend of mine, and I'm focused on looking forward. I don't want to go backwards over the territory that's been canvassed in recent weeks. I know this has been a really tough decision for him. He's got my full support. I think what he's done is very honourable. We are different people. We've got different operating styles, but I think David has made a really tough call, and I just really want to acknowledge him and how difficult that would have been for him.
Are you happy with everything in terms of the way the ministry is running at the moment?
Oh, look, every minister has a different operating style, and when there's a change of minister, regardless of what portfolio it is, there's always a period of adaptation for the public servants who are working with that minister, and no doubt that will happen now with health as well.
Have you had the briefing for the incoming minister yet?
We had some briefing because I had question time today. I had to answer my first two questions as Minister of Health, so I needed to be briefed on the topics that I was being questioned on there. But we'll get into more detailed briefings in the coming days.
Have they identified with you any urgent things that need your immediate attention?
Yeah, well, they identified two urgent issues with me today, and they were issues that I was being questioned on in the House. So they clearly made it to the top of the priority list. But in terms
of action, I mean, Minister, have they come to you and said, look, you're the Minister now, these are the two top things that you need to get done in the next couple of days?
Look, we're going to get into much greater detail into the portfolio. Obviously, I've got some questions for them around contact tracing and around the testing regime around COVID-19, which I've got, those are questions that I have for them. And then we'll get into other issues as they arise.
You say that you started having talks with the Prime Minister over about a week, right? So when exactly did she give you the job?
We confirmed that yesterday.
What time?
Look, I wouldn't know the exact time. It was sometime yesterday.
And so when did your briefing start? When was the first briefing you had on the health portfolio?
At 1 o'clock this afternoon.
That was your very first one?
It was indeed, yep.
And that is the new Health Minister, Chris Hipkins.